Thank you for joining us. My name is Calypso Chalkidu, and I'm the Director of Global Health Policy at CGD and a Senior Fellow. I'm also a Professor of Practice in Global Health at Imperial College London. Welcome to you all. Today we're discussing COVID and the COVID response in Africa. Make no mistake, in the battle to contain the pandemic, trade-offs are real and tough choices face policymakers in wealthy and in poor countries alike. According to a recent analysis by the London School, for every one COVID death prevented from cancelling a routine vaccination clinic visit, there could be 140 deaths in children due to the disruption of routine childhood immunization across Africa. For TB, a 3-month lockdown followed by a 10-month restoration period could lead to an extra 1.5 million lives lost to TB over the next 5 years, setting the global fight against TB back by 5 to 8 years, back to 2012 incidence levels. Already in India, we're seeing an 80% reduction in daily TB notifications. So prioritizing scarce resources is now and will be for the foreseeable future all the more important, making more health for the money not an optional extra, but a necessary element of domestic and global health policy, more so in the post-COVID era. We live in extraordinary times, and we at CGD hope our work can make a small but valuable contribution to understanding the challenges we face and to coming up with evidence-informed, practical, actionable ways for addressing them together. I believe the discussion today is such a contribution, and I very much look forward to it. Thank you for joining us. I'm now passing on to Masood Ahmed, CGD's president, and today's host to introduce our speakers and get us going. Thank you. Masood, over to you.
Thank you very much, Calypso. Thank you for that introduction, and thanks to all of you for joining us, our panelists, who I will introduce in a moment, and all of you who are joining online. And I want to remind you that we very much want all of us to have this as an interactive conversation. So I encourage you to send in any comments that you have, please, or questions that you have for the panelists, and we'll try to get to as many of them as we can during the course of these 90 minutes. I want to, before introducing the panelists, just say one word. Why are we focusing on Africa? And it's an obvious, the answers are obvious, but it's just worth reminding ourselves that even as we came into this crisis, we had challenges facing health systems in all of the countries of the African Union, and some of them struggling already to cope with the multiple chronic and other health challenges they face. And now, on top of that, we face not only a health crisis, but also an economic crisis that comes in the wake of it, the shadow of which is likely to be widespread and long-lasting. And we're going to see already, we are seeing an impact in terms of near-term effects on livelihoods, on economic activity, but also many concerns emerging about the sustainability of the debt levels that many countries have, financing that they will need, of the terms on which those financings will be made available, and how the trade-offs between different kinds of priorities. Calypso talked about the priorities within the health sector, but within health and other sectors, schools, in education, economic activity, are already beginning to pose almost unconscionable trade-offs that people have to make every day. And policymakers are going to be grappling with this for years to come. And it's for that reason that I think the panel we have today really is probably the best 3 people that we could bring together to have this conversation, because they are very much involved not just in the current fight against COVID, but also in helping the continent go beyond this crisis and deal with its challenges. And I want to start first with Her Excellency Amir Al-Fadl, who is the Commissioner for Social Affairs of the Africa Union, and I want to get her perspective on how she and her colleagues in the AU now see the crisis unfolding, how they and the African CDC are working with other institutions, including the Global Fund and Gavi, who are the two that are present here. And after Amira, I'm going to turn to Seth Berkley, who is the CEO of Gavi, the Vaccine Alliance, and I'll get his perspective, and then to Peter Sands, who is the Executive Director of the Global Fund. And I think just as a reminder for people, the Global Fund and Gavi are the two largest multilateral organizations involved in the health sector now. So I think together between them, they have a critical role to play. They have been playing a critical role and will continue to play that. But how will that role change as a result of this crisis? So we'll come to all of those questions. The plan we have is to ask each of our panelists to sort of start off, and we'll ask them to speak for about 7 minutes or so. And less is even better, but 7 minutes or so. And then once we've had that, we'll go to a set of questions and try to bring more of an interactive dimension. So with that, welcome to all three of you for your time and your presence here today. And let me start with Amira Al-Fadl and turn the microphone over to you, Commissioner.
Thank you very much, Mr. Masoud Ahmad, our moderator, and good evening to all the participants. And let me commend my two partners, Gavi and Mr. Peter Sands and Mr. Berkley, CEO of the Vaccine Alliance, Gavi, and the Executive Director of Global Fund, Mr. Sands. Thank you very much, and I commend highly the partnership you have with the African Union Commission. And thank you to you, Mr. Masoud, the moderator. Thank you for organizing and convening this very important meeting at this very critical time of the COVID-19 pandemic. As on our side at the Africa continent, we are the last continent to be hit by this pandemic. But from the beginning, when this COVID-19 started in China, we were following up as a department responsible or mandated on health issues in Africa, and also our technical institution, the Africa Center for Disease Control and Prevention, was alerted early since January. What we did, Mr. Masoud, is in February, when the first case happened in Cairo, in Egypt, that's when we said, okay, we need to convene quickly the ministers of health of Africa in an emergency meeting. And that's what we did. On the 22nd of February, we convened an emergency ministers of health meeting here in Addis Ababa, and we requested the attendance of the Director General of WHO, Dr. Tedros. He participated from Geneva through VTC, and our chair of the Union, the African Union Commission, also participated in the meeting. In that meeting, we prepared the draft for the joint continental strategy on COVID-19 for Africa. We presented the strategy to the ministers. The attendance was very good, and it was a short notice, but because people from the beginning, they felt that there is a crisis coming, so they need to be prepared quickly. The strategy was adopted by the ministerial meeting, and then later we took it to the heads of states and governments in their Bureau of the Assembly meeting, chaired by the chair of the Union to this year, which is President Ramaphosa of South Africa. They endorsed the strategy. So what I want to say at this point, that Africa from the beginning decided on acting as one continent, in solidarity, in unity. And for me, this is part of the strength of the response we are doing now in Africa. That the heads of states and governments, they decided that Africa will be led by the African Union Commission in the response, and they will be led technically by Africa CDC. This is a decision made since the 26th of March, when the heads of states convened the Bureau of the Assembly meeting. So we had our clear vision put in this strategy. We have the endorsement of the heads of state and government. That means the political will was very clear from the beginning. And the meeting from the beginning also asked us to establish mechanisms for implementation. Because the implementation is not only on the national level, so the ministers, they will take the strategy and they will align national strategies. No, it's not only that. Because the response is agreed upon to be on the continental level, they created three main committees. A committee from the ministers of health, a committee from the ministers of finance, and the third committee from the ministers responsible on transportation and aviation. Because one of the first measures being taken everywhere, not only in Africa, is the shutdown of the airports and the lockdown. And so we needed these ministers responsible about transportation to be from the beginning with us. The three committees were established, and we brought in the RECs, the regional economic communities. The executive secretaries of the 8 RECs identified by the African Union are members of these committees. So we brought the regional level with the continental level, and then we have the ministerial level representing the representatives coming from the national level. This is the mechanism on how are we dealing with this COVID-19, what the strategy and the mechanisms we are using. Let me add to that, the president of South Africa, as a president or a chair of the union for 2020, he appointed 5 special envoys. 4 of them are former ministers of finance, very well-known Africans. Now most of them, they are working in the international community. And let me name here Madame Ngozi, because she's the chair of board of Gavi. She's one of the 5 special envoys. These 5 envoys, they have been mandated on two things. First, they asked them to go and look into the issue of the economic impact, the cancelling of the debts on the poor countries, putting moratorium on the payment of the interest, to deal with the economic crisis that's coming with this pandemic. But also they have been mandated to generate and to mobilize resources for the fund. Because also we have been instructed from the Bureau of the Assembly to establish a fund, anti-COVID-19 response fund. Because finance and budgets is one of the main challenges we have here in Africa. Because if Africa CDC wants to act and to lead the continent in this fight against COVID-19, we need resources. With the resources we have internally, it's not enough. It will not enable us to support the member states. So the first decision they made after putting the structures is to establish a fund. I can tell you today this fund is established. The board of trustees, the members were chosen and appointed. We have elected the chair and the vice chair. We had 2 meetings of the board. Member states, they made pledges to the fund. The total figure is $61.5 million. This money is a seed money for the fund and also for the support for Africa CDC. So they show their seriousness, the heads of state, because these pledges were made in the meeting of the Bureau of the Assembly. And as I mentioned, they had convened 4 meetings since they started. And there is a meeting for the Executive Council, there is meeting. So they put money in the fund. The fund is now established. The fund is open for all our private sector, because the private sector is also represented in the fund, because we engage the private sector also from the first week of dealing with this crisis. We brought in the private sector. We had conversations with the private sector, and they are represented with 3 seats in the fund, in the board of trustees. So I don't want to take a long time in giving the details, but I can assure you that there is a leadership now in Africa. We have learned the lesson from the Ebola that happened in West Africa between 2014 and 2016, because at that time, the lesson learned that Africa has no technical body to lead on the fight against any epidemics in the continent. And that's why after that, they accelerated, the heads of states and government, they accelerated the processes of establishing the Africa CDC. The Africa CDC now is leading this fight. Our strengths at Africa CDC is being tested in the Ebola outbreak in DRC in 2018 and 2019, but this one is a big test for us. But my belief with what we are doing now, having leadership, having looked into the issue of mechanisms, looked into the issue of the funds and the financial resources, I believe we are on the right track as Africa. Today, I'm speaking to you in this meeting. The number of the cases we have in the continent is 66,000 cases. The number or the death toll is 2,300 in the continent. The number of the recoveries is 23,000 plus. We are looking around us, we are learning lessons from the rest of the world. We are also seeking the help and the support of our partners. And maybe you already know that we are receiving in-kind support from Jack Ma Alibaba Foundation. We are receiving support from some of the Gulf countries. We are receiving financial support from our partners, Bill and Melinda Gates. A lot of partners, I don't want to name names, but let me end by saying that whatever we are doing it in full partnership with WHO. We are working very closely with WHO as a global health custodian. We are engaging them. We have a technical task force that meets twice a week under the supervision of the director of Africa CDC. We have all the technical level representatives from the 55 member states. And they are the one who are coordinating all what we are doing, whether in the issue of pool procurement of the resources and medical commodities for Africa, or the issue of sending responders and volunteers to support our member states. So in brief, this is what we are doing, and maybe later I can elaborate more on the areas we did support already our member states, like the area of diagnostics and building the technical capacity of our lab technicians in the continent, what we are doing, the online training we are doing for the physicians and for contact tracing, all these issues. Maybe later I can elaborate more. But this is just a brief introduction on what we are doing in Africa.
Thank you very much, Commissioner. As you say, this is a big challenge for the CDC in Africa, but actually it's a big challenge for everyone right now. And in some ways, I think it's also fair to say that the kind of early leadership at the political level that you were able to demonstrate in Africa is also a lesson that's not just a lesson that you learned from Ebola and that is relevant for you, but is also a lesson that I think is relevant for other parts of the world where I think some people are still struggling to try and put together the same kind of response. So we'll come back to many of the issues that you raised, but I want to turn now to Dr. Seth Berkley, as I said, CEO of Gavi, Vaccine Alliance. So the good to get your perspective, Seth, on how Gavi is participating in the fight against COVID in Africa, but also perhaps the point that Calypso touched, which we'll delve into no doubt more in the questions, but your initial take on what does this mean in terms of the impact on preserving the mission and mandate in terms of vaccinations that you have been, immunization and vaccination that you have been involved with and leading in Africa for other deadly diseases.
Thank you, Masood, and thank the Center for Global Development for hosting us, bringing us together. It's great to see my colleague Amira here and Peter, of course, as we were joking about before we started. So let me start, first of all, and say that, Gavi is trying to respond, and I think you'll see some similarities with Peter's comments afterwards because we work as sister organizations on this. So the first thing that we did was we are both supporters of health systems in Africa, and I must say that if you think about the health systems that we provide on immunization. Right now, immunization is the most widely distributed of all health interventions. It reaches, for the routine system, about 90% of families, and that's really important. Obviously, our longer-term goal is to try to get that to 100%, which is going to be critical to deal with epidemics. But when this first happened, we immediately reallocated some of our health systems money, 10% of it, for countries to be able to buy PPE, to be able to buy diagnostics, not because that's our core mandate, but because we thought we could react quickly and be flexible. And the Global Fund did something similar, and I'm sure Peter will talk about that. The importance of that, and what's interesting, is that a number of countries actually didn't want to reallocate because they were worried about having that funding for health systems. Second important point we did is to really try to make sure that routine immunization gets prioritized. Calypso already gave some statistics about what happens if you stop routine immunization. And of course, this is one of our worries. You already heard from the commissioner about lockdowns of airports. For example, the underbelly capacity went from quite adequate down 80% in the third week of March. We began to have problems with supply chain. We also have a demand problem where parents are not wanting to step forward. But the WHO's overall recommendation on this is keep routine running as much as you can, stop preventive campaigns, and when outbreaks occur, your response should be done on a case-by-case basis based upon where it is. So that's what we're trying to do. But invariably, we're seeing now, because campaigns have been stopped, we're seeing population immunity go down because we're seeing clinic workers being distracted and pulled for the COVID response. We're seeing numbers come down. And so after lockdowns, we have to be prepared to immediately go back in and do catch-up campaigns. And there's going to be an urgency to that. We did this in West Africa post the Ebola outbreak. Is, if outbreaks haven't occurred by then, how do we get population immunity up quick enough to prevent those outbreaks? Of course, eventually you want to make sure that immunization gets back to where it was, if not better. And one of the silver linings might be stronger systems. And then the fourth piece that we're thinking about is the issue of COVID vaccines. And we've already heard a little bit of this ACT accelerating COVID tools effort that's going on. That started about 2 weeks ago under the leadership of WHO, and I'm sure Peter will talk about that as well. We were both there for that launch. And then it really took another boost when the EC held a pledging conference for the global coronavirus response, where they had over 30 heads of state, many of the countries represented. And one of the important messages I want to give from that is that global access was on everybody's mind. That heartened me because this is going to be very important. So as we're thinking about vaccines, the good news is that the science is moving forward incredibly fast. There's more than 100 vaccines now in development. There are already 8 in clinical trials, a couple of them already moving into phase 2 trials. The challenge for us is going to be making sure that there is a commitment to global access, that there is scaled up manufacturing that has to occur now to be in a position to produce large enough vaccines for everybody. And one of the things that Gavi is responsible for in leading on the vaccine pillar, along with CEPI, the Coalition for Epidemic Preparedness and Innovation, is how we might create an advanced market commitment to help with access. So 2 components that are important. One, global access, making sure there is the best vaccines available for everyone in the world. Of course, day one, there won't be enough, but how do we phase that out as a prioritized action with the normative leadership of WHO? But the second one, very relevant for what we're talking about, is how do we make sure there's financing available to help poorer countries pay for access to vaccines and also to strengthen their health systems if necessary. Obviously, we have a distributive system for vaccines. We have cold chain, which may be required, but this may need to be enhanced based upon the volume of vaccines, and also will obviously be changing who gets vaccinated here, not just perhaps in outbreak settings, healthcare workers, but also the elderly or people with chronic diseases. So these are some of the activities that are currently being prepared. we can talk about all of those in the questions and answers. But really, just to finish, to say this is an unprecedented time. And as we think about this is a global problem that needs a global solution. If we don't optimize globally, we will not have the best science. And that's true for every country in the world. We want to understand where the best science is and then scale that up and make it available to everyone. And we're only safe if the whole world is safe, because if there are places with reservoir of virus that can continue to spread back to other parts of the world or get more virulent or mutate, that's not a good situation globally. So some of those mindset changes are really important during this period as well.
Thank you very much, Seth. I think you raised some really important points, and we'll come back to them. And I think we will want to dive a little bit deeper into this question of how do we ensure global access to vaccines, to therapeutics, and what are the mechanisms by which one can ensure that, and how does one find a way to do that in a way that is both efficient and seen as fair? So I think there are going to be difficult questions ahead, and we'll want to come to that. But before we do that, let me turn to Peter Sands, and get Peter's perspective on it. As I said, the Global Fund is now the largest multilateral organization supporting global health. And the Global Fund has been working to help countries develop health systems, and particularly critical programs in HIV, TB, malaria, and the big question is the role that the Global Fund will play in the fight against COVID, but also how does one sustain and preserve the progress that is being made in the fight against those other diseases in Africa. So, Peter, over to you.
Thank you, Masood. And it's great to be on a panel with Seth and Your Excellency Amira. And thank you also, Calypso. It's worth reflecting, actually, that the Global Fund to fight AIDS, TB, and malaria was created in response to the last big pandemic to hit humanity, HIV/AIDS, which, as of now, has killed about 32 million people. And the driving rationale behind the creation of the Global Fund was about access to antiretrovirals. And I think one of the things we need to learn from that is actually we were too slow that time round. Millions of people died because we didn't get antiretrovirals to places like Africa fast enough. And we need to learn that from that. And in the way that Seth has been talking about with vaccines, but also with diagnostics and therapeutics, is the issues of scaling up global access, equitable access, are massively important because so many lives are at stake. We are acutely conscious of the interaction between the challenges of COVID-19 and the ongoing challenges of the three biggest infectious diseases in the world, measured in terms of how many people they kill: HIV, TB, and malaria. And it's worth putting in context, and this is without diminishing the threat of COVID-19 at all. COVID-19, I think, has killed about 290,000 people as of yesterday. The running total for the year for HIV, TB, and malaria would be about 1.2, 1.3 million. And sadly, the biggest share of that are people living in Africa. We have been enormously impressed, actually, and I think the leadership that Amir has shown and the AU has shown has been fantastic. The way Africa has responded to the challenge of COVID-19, fast, decisive, coordinated response has been enormously impressive. And testimony to that is the fact that to this date, only, I think it's, you said, Amira, 2,300 people have died. It will get worse. And the issue, I think, the big challenge for Africa is that some of the things that have been done are going to be really, really difficult to sustain. Lockdowns are difficult to sustain in rich countries. but where households live on the income they earn each day, they're very difficult to sustain. Where people live in very close proximity to each other, social distancing is very difficult to achieve. Clinical care, ICU capacity in many African countries is extremely limited. So actually, Africa is going to have to leapfrog to the most sophisticated strategies around massive testing, tracking, tracing, if it's to control COVID-19, not just to save people dying of COVID-19, but to save people dying of the knock-on impact on other diseases. Because I think it is far from implausible that the true cost of COVID-19 in Africa is going to be measured more by its impact on other diseases, either by children who haven't been immunized or from the incremental deaths due to HIV because people haven't been able to get their treatment and maintain virally suppressed, or incremental deaths due to TB. We've seen some dramatic reductions in TB case notification in Africa and elsewhere in the world, and or disruption to services, treatment services for malaria. One of the great achievements of the last several years has been reducing child mortality due to malaria. The trick to that is when a child gets a fever, you want them diagnosed and treated within 24, 48 hours. If disruptions to health services, if you've clinical health workers being sick or unable to get to villages, if parents are scared to take their kids into clinics, we will see that death toll go up, and we will see it go up very, very sharply. It's a sobering reminder that the Ebola outbreak in West Africa in 2014-15 killed more people due to incremental deaths due to malaria than it did to Ebola. So from a global fund perspective, we sometimes get asked as to whether or not we are diverting our attention from our core mandate of HIV, TB and malaria to fight COVID. And we say no. To fight HIV, TB and malaria, we have to fight COVID. Because if COVID overwhelms the health systems, if it makes health workers sick or incapacitated, it will have this massive impact on HIV, TB, and malaria. So what the Global Fund has done is we introduced, a bit like the way Gavi did, we introduced flexibilities in our grants to enable countries to use funds they already had deployed to them at the beginning of March. So far, 75 countries and 5 regional grants have used that flexibility. It's a flexibility with a total envelope of about $500 million. But we quickly realized that that wasn't going to be enough. So we have also introduced a second mechanism, and that mechanism releases another $500 million. So in total, we've made available about $1 billion to do 3 things. One is to help countries adapt their HIV, TB, and malaria programs to the COVID environment. So it's some of it's really simple stuff. It's dispensing 6 months of antiretrovirals instead of 3 months of antiretrovirals. It's distributing bed nets to individual house doors rather than bringing them to the central village and getting everybody in the village to come and collect them. But a lot of these things actually do have incremental costs. Secondly, it's to help countries with their immediate COVID-19 responses. And we are providing personal protective equipment, PPE, we're providing diagnostics, and we're supporting the whole range of emergency response activities of different countries. And thirdly, it's about fixing urgent gaps or deficiencies in health systems, whether it's a lab capacity and so on. And so we hope from that to be able not just to help countries respond effectively to COVID-19, but also to be able to protect their ability to continue to sustain the programs they're running against HIV, TB, and malaria. As I say, I actually think that Africa has responded remarkably and impressively quickly. I think the challenge, though, is that we're at the very early stages of this battle, and the scale of the resources and the degree of sort of community support and engagement to sustain it is going to be enormous. So we have a big fight ahead of us, and it's going to require both leadership within the country, within the countries, within the continent. It's going to require leadership at a community level, but it's also going to require a lot of support from outside.
Thank you very much, Peter. Maybe a good place to start the next part of our conversation is to pick up on the point that you just made, which is so far African leaders have demonstrated a sort of proactive approach, political leadership. They move quickly on the lockdowns. They move quickly on trying to put in place economic measures. They're working with international partners. And the numbers that, Amira, you cited, at one level are actually lower than what some people were thinking could be the case in terms of fatalities. And Peter, you were putting them in context in reference to the damage being done, the toll being taken by other diseases even now, and so it's sort of important to keep that in perspective. And I think you mentioned also that, and this is a point that's been raised by a lot of policymakers from developing countries, that the strategies that are being used in rich countries to control the spread of the pandemic are not sustainable. They're not, and maybe they're not appropriate. So I actually think that even the terminology matters, because it's not that they can't do it, but that it's probably not the right thing for them to do, given the trade-offs that they face in terms of the economic consequences of having people not work, given the fact that the social distancing limitations that come from large numbers of people living in small dwellings make it hard to achieve the same outcomes. So the returns to the strategy, if you like, are less from a global health perspective, and the economic costs are larger, and people are already beginning to sort of chafe at and say we want to get back out of these strategies, and so there's going to be pressure to relax those, and so you might well see a pickup and a spike in the months to come, and then it's always going to be a bit harder to deal with that. So in some ways, the more difficult challenges are ahead of us, and at the same time, you have these difficult trade-offs to make in terms of how you continue to put the emphasis on existing diseases. I'd like to get a little bit your sense, maybe starting with Amira, on how much of a conversation is now happening amongst African leaders, not just about what to do to control COVID, but also to think about the links between that strategy and what they're trying to achieve to sustain progress in global health in other areas, and then also some of the economic consequences of that. And then come to the other two panelists as well.
Thank
Amir,
you.
do you have any
much.
thoughts on that? Yes.
Yes, thank you very much, Mr. Masoud. Thank you very much, and I enjoyed listening to the two presentations from Global Fund and from Gavi. The conversation in Africa never stopped on all levels. And we are very much aware that in most of our countries, I don't want to generalize, but in most of the African countries, we have very fragile health systems. And I also agree to the statistics being mentioned that more people are dying with malaria, or with HIV, with TB. And my position and the position of my staff here at the health staff, not only the Africa CDC staff, but also the other two health divisions. Our position is not pro to redirecting all the funds that's allocated for the three diseases, TB, malaria, and HIV, to be redirected for COVID-19. Because if we direct all the resources to COVID-19, then we will have a gap on the fight we established and the routine programs we used to do, whether on immunization or other programs. It will be affected, and we will have more people dying from the other three diseases. So we are not in support of redirecting all the funds, maybe part of the funds, just at this emergency, but not to look into putting all our efforts on COVID-19 and creating gaps in the fight we are doing for years and years for the other three diseases. This is the position of the African Union on this. Also, we know that this COVID-19 is not an easy battle to win. And when we spoke yourself now about prevention, about putting measures, for example, of social distancing, it's difficult to apply social distancing in Africa. We are leading campaign, we are working on raising the awareness, we are engaging even celebrities in sports and in culture to take out our message, but we know the type of life we used to. We live together. We have large families living in sometimes small houses. And it's difficult to apply on the level of the family the social distancing. If you can apply it at the workplace, if governments can put measures on this and they can observe it, it's difficult to apply at home. So the social distancing, wearing the mask, these measures that's being shared by the whole of the world is not enough for Africa. And because there is culture here that might not help us along the way on implementing these measures. We are putting more emphasis on testing. We are planning on doing more and more testing and more testing. This is one of the priorities we are working on now. The chairperson of the Commission launched an initiative of 1 million tests to be done, and in 1 month, but our target is 10 million tests in 2 to 4 months is maximum. We are not just requesting member states to do it and just to send us the numbers or the figures. No, we are going to support them by providing the testing kits. And we bought a lot at the beginning of this pandemic. It's not only the donations we are receiving, we appreciate the donations from JACMA, but we bought directly, and we have stocks in Senegal, we have stocks here in Addis Ababa. We are going to be giving to member states the testing kits. We are going to be following up the numbers we put as a challenge for ourselves, that we will test. We start with 1 million and go up to 10 million, because testing is what's going to give us the reality of the epidemiological situation in the continent. To answer your question about the conversation on the other socio-economic impact in the continent, the African Union now developed a full document. They called it a comprehensive document, the African Union Commission comprehensive document on the socio-economic compact of COVID-19. And in this document, it's a comprehensive document that every department in the African Union participated in developing it. And not only the 8 departments we have in the Commission, but even NEPAD and the other technical organs we have. And this document is going to be the document we are going to implement, because it is obvious that all our planned activities for 2020 now are put on hold. We cannot travel, we cannot organize summits, even our summits are now postponed. So our focus will be to react, not from health perspective only, but from a comprehensive way in dealing, because we know our economies which will be affected in a very bad way. There is losing of jobs in the continent, especially the medium and the small businesses. It will be affected. More and more people will be falling in the area of poverty because of this COVID-19. So we are not focusing on addressing only the health issues and the health impact of COVID-19. We are looking to the holistic ways on how to address it. And that's why I said it's part of the mandate of the 5 envoys is to go and talk to the World Bank, to go talk to IMF, talk to the G20 on how to ease the burden on Africa regarding the debts, regarding the interest on the debts itself. And this is part of the priorities that the African Union is keeping it in the radar of our heads of states and governments, and is on our agenda in every meeting of the Bureau of the Assembly.
Thank you. That's really helpful. So I want to maybe both Seth and Peter, you can, you both are very well placed to respond to this. And I guess my question is that, in a way, Seth, you said that, the big thing we have to remember about this crisis is that it's a global crisis and that it's not solved anywhere unless it's solved everywhere. And I think that obviously is true and obviously has an impact in terms of why we need to address it. But I worry sometimes whether it might also be a little bit of a two-edged sword in terms of, it could cut both ways, because down the road, when people in the rich countries start looking at where in the global health agenda the priority lies for their funding, and a lot of the funding for African global health systems development comes from rich countries. A lot has come from domestic resource mobilization. Africa actually funds a lot of it itself, but domestic resource mobilization is likely to be challenged over the next few years as countries have to cut back on their budgets. And so we can't rely on some of the same projections that we had before the crisis for how much money would be mobilized within countries to take on the co-sharing of the global health burden. But the rich countries' priorities might be very much more focused on the global health pandemic, precisely because it is global and can affect everyone, than on sustaining progress in those diseases where the spillover dimensions aren't as evident, aren't as great. So how do you see that challenge playing out in the coming years in terms of the funding for global health, in terms of what is prioritized, and in terms of also recognizing that probably many of the assumptions that one made about the ability of poor countries and middle-income countries to pick up a bigger and bigger share of the funding are going to have to be revised as a result of this crisis. How do you see that whole scenario on the funding side impacting the discourse and also the programs in global health?
So thanks for the question, and I think the answer is there's going to be pluses and minuses. So let me come back to that in a second, but just going back to the previous point, I wanted to quote Dr. Chikwu, I think we all know runs the Nigerian CDC, and I was talking to him and he said, if another person comes to me and says, oh, you just need to do what Korea does, you will be fine. And he said, no, I can't do what Korea does. We live in a different way. Our systems are set up. We have an informal economy. And I think the important thing that Africa is doing that's critical is local innovation. And we can learn from other countries, but it's not even going to be same from one country to another in how to respond to this. And that's just going to be important as how we think about, how this affects our health systems, what we do, how we change our market-based practices, how we change our food practices, et cetera, et cetera. But to get to your question, the reason I said plus and minus, Peter and I have been going around talking about health financing for a long time. And one of the things we've talked about is more money for health, but we've also talked about more health for money and the importance of allocative efficiency and the importance of focusing on primary health care and focusing on reaching the poor and doing all of that. And so one of the things about a pandemic that really makes it clear is the importance of prevention, is the importance of the comprehensiveness of that systems, the importance of leaving no one behind. I mean, if you go back to the 2014 Ebola outbreak, the reason it spread so widely is because it occurred in a region of Guinea that didn't have resilient health systems, and therefore it took 3 months to diagnose that it was Ebola, and it spread. If you look at the current Ebola outbreak, while we were all paying attention to the Ebola outbreak in DRC, 2.5 times as many people died of measles than died of Ebola. So I think one of the silver linings might be more focus on primary health care, on prevention, on the poor and leaving no one behind. And that's going to be important because as the funding comes back up, and of course, countries will still spend money. Yes, the figures globally are terrible, 3% reduction in global growth in 2020. In Africa, maybe 1.6, 2%. These are terrible numbers, but there still will be spending. And the challenge is, can they target that well in terms of what's going forward and build a stronger, smarter system? The other thing I'd say about that is that technology has a role to play here. I mean, if you look at Africa, we went from having very few fixed phone lines to having more mobile phones than there are toilets. We've seen, digital payment systems like M-Pesa, take over, become 50% of the GDP. This is a time for us to take advantage of technology to do the work better, to create the efficiencies we need, and to make sure we fully cover. And my hope will be that will be part of the investments now. But it is going to be a very tough period. I worry a lot about food supply during this period. I do worry about some of the trade issues that the commissioner talked about. And so I think we have to be realistic on where we are on this. We have a policy of co-financing. We will look on how that policy needs to be adjusted and changed. But what you don't want to do is lose this allocative efficiency that has been slowly built up, because that's going to be critical to when we return to normal. Over.
Thank you very much, Seth. Peter, what's your take on this set of issues?
You're muted, Peter.
There we go. Nothing like remembering to turn your mute off.
It's not half as embarrassing as not remembering to turn your mute on.
Oh, well, that's much worse. Yeah, that's much worse. To start with, I completely agree that the strategies have to be tailored to the environments. And I would stress the point that even within Africa, there will need to be very different strategies depending upon the different countries and regions and communities. But there will be some fundamental basics around access to tools. And that's obvious when we get to a place where we get a vaccine. But it's actually urgent right now in terms of access to diagnostics. As Amira was saying, that is, testing has to be a central part of the strategy, and massively scaling up the numbers of tests has to be a critical priority. I mean, the way we're looking at it is that the 5 billion poorest people in the world, we need to ensure that, roughly speaking, about 500 million tests are available in the next 12 months for that population, and that includes Africa. So we have to think very big about the numbers of tests, the labs, the lab technicians, the deployment of them in a way that we have never done before. And so the sheer scale of what needs to be done to mount a truly effective response, not just in Africa, but across the low and middle income countries more generally, is daunting, but it also needs to be done. It absolutely needs to be done. Your point about the discourse and funding, I think, is a very important one. I confess I think we need to have a different kind of conversation about notions of global health security. Because too often what people really mean when they talk about global health security is diseases that might kill people sitting in the rich countries in the world. The global aspect of it is not really as global as they think. And so diseases like malaria aren't seen as global health security issues because, put bluntly, they only kill children in poorer places. I don't think that's sustainable. I think we have to come out of this crisis with a conception of global health security that is truly global and that encompasses the measles outbreaks. It encompasses malaria. It encompasses HIV, as well as the coronaviruses and the new threats that will potentially come our way. And that I think that's the only ethically sustainable approach. But B, it's the practical approach, because the tools you need, the infrastructure, the cold chain, the labs, the community health workers, the things you need to fight existing infectious diseases are also the things you need to fight new infectious diseases. You don't want to build one set of things for fighting the existing things and another set of things through a sort of global health security stream. You have to take an integrated approach. So that I think is going to be one of the most important outcomes, and could be potentially quite a positive outcome for global health if we can come out with a much more sort of integrated and sort of coherent approach to this. One other aspect that I would want to stress in thinking through, and one thing we're very focused on when we think through the challenges for Africa, is the importance of frontline health workers. Africa has far fewer frontline health workers per capita than most parts of the world. It simply cannot afford to lose them. What we have found in every economy, every country that's been hit by COVID, is that health workers become absolutely critical, but also acutely vulnerable. And as I say, Africa simply doesn't have enough of these often enormously dedicated, courageous people who are the community health workers, the lab technicians, the doctors in a clinic, and so on. So the basics around protective equipment for health workers are going to be hugely important. And that comes down to another access issue, because we're facing huge supply constraints on getting adequate quality and quantity of personal protective equipment to health workers. And certainly when we think about things like sustaining malaria programs, we think one of the single most important things we can do is make sure those community health workers are protected. Because if they're not protected and they start getting ill, then the malaria deaths will absolutely increase.
Thank you, Peter. So I think
can I just add one little point?
Yes, please. Come right ahead.
I think I agree with everything Peter said, and the other thing that we have to keep in mind is the world is changing. So Africa now gets affected by antimicrobial resistance from countries in the West, but also countries in the West get threatened by global warming and movement of insect vectors that they didn't expect before. And so you end up with these weird situations. As Peter says, you had a yellow fever outbreak in Angola. Everybody says, well, it's a yellow fever outbreak in Angola, but it went to many countries in Africa. It threatened us in Kinshasa. It threatened Uganda, but it also ended up going to China. So if we can end up in a mindset that doesn't say it's us versus them, we need to have global health security for the world, that will be really helpful. And I think that's where we need to go, because we are so interlinked, as Peter implied. Over.
Thank you, sir. So I think maybe just useful to pick up on one thing that is implicit in what all of you have said, which is we're going to have to rethink what global health security means. How do we set out the elements of it, and how do we then operationalize what that means? And of course, that means many actors have different perspectives on this. So we have three very important actors today participating in this conference. But you have the World Bank, even in the development space, a big player. You have the WHO, which has a big role. You have individual countries. And then, of course, we haven't talked about it yet, but there's the private sector. Private sector is a big part of delivering global health today and will be a big part of the solution going forward. And each one comes to the table with a different set of incentives and a different perspective. And I want to get a little bit of a sense from you on, maybe we'll start with the private sector and then go to the big picture of sort of how one defines the global health system of the future. You know, what is holistic global health security in the future look like? But before we get there, the private sector. So any examples, this is a question also that's been asked online, are there any examples of that you would like to say of encouraging ways in which you see the privates engaging with the private sector and delivering both the response to the immediate challenge and thinking about the future? Or are there things that you worry about in terms of how do we get the incentives right so that the private sector contribution aligns with whatever is the social objectives that you have as we all have as public policy professionals in this? Maybe I'll start with Peter and then work back, and then I want to come to Amira last on this, because I want Amira to get a sense from you of, you know, what has been the experience in the AU and in African leadership of the engagement with the private sector in the last few months and going forward. But I want to kind of come to that at the end. But Peter, perhaps come to you first.
Thanks. Look, I think there are many great examples right now of private sector engagement. Some African business leaders have been very involved. Many of our private sector partners have really stepped up in an enormously sort of proactive and supportive way. The various therapeutics, vaccines, and diagnostic pillars within the ACTA partnership, the Access to COVID Tools partnership, have seen great engagement by private sector players. I think the challenge is that it's one thing to get fantastic response when you've got a crisis. The question and the challenge has always been, how can you get, and to be fair to them, not just the private sector, but anybody involved in the economy, including the IMF, the central banks, and so on, interested in this when there isn't a crisis. And I'm hoping that if there's one thing that's good about how bad this crisis is that finally our economic leaders and masters have realized that global health can have a massive impact on the economy. And therefore, we need to think about health issues as economic risks. And the reality is the private tech sector will take its lead from economic and financial policymakers. And we need them to take it on board. And it's things like having IMF Article 4 assessments, including health risks. It's things like, S&P including in its country ratings assessments of health risks. It's those kinds of things that will set a tone that help the private sector take on board the potential for things to happen. Because although, as I say, I've seen fantastic examples of response to this crisis, we also need to build in the awareness of health risks more systematically in the future. Over.
Thank you, Peter. And I'm going to ask Seth next. But before I turn to you, Seth, I just want to say a small footnote to what you just said, Peter, which is, I think the flip side of that is a better ability for a lot of the health sector leadership to be able to demonstrate the effectiveness of the ways in which resources are being allocated within that sector. I mean, in my previous life, I used to talk to a lot of finance ministers and central bank governors, and if you talk to them about health sector spending, one of the things that I would hear often from them is that they really didn't have a very good handle on whether the choices that were being made within the health sector and where to spend money were being done on the basis of some trade-off criteria that they could understand and appreciate. And I think, it's interesting that the one question that I've just got online from, we got before this from Dr. Leonie Sorgos, the Minister of Health in Burkina Faso, is the fact that she's saying, look, no matter how much we get in additional resources, our resources are going to be short of what we need. And so we also need to find ways to focus on how to spend those resources most efficiently and to be able to demonstrate that we're doing that to build confidence for the allocation. So I agree with you entirely that I think this crisis may well be what puts health risks on the agenda of macro policy makers in ways that they haven't been there in the past. And I think the more one can do to bridge that, the gap between the two, the better off both sides will end up being, probably.
If I can respond on that, I do think the chasm in understanding between people in the health sector and people in the financial and economic sector has not been helpful. And I say this as somebody who, in my previous role, my previous role was running an international bank. But then in between that and this, I spent some time at Harvard trying to bridge that gap without, to be honest, that much success. But to give you an example, a very recent example, I wrote to a central bank governor in late February saying, we have a massive problem coming our way. And the economic consequences of this, haven't even begun. Maybe we should have a chat, because I'm not seeing that people in the economic and financial sector are seeing this. And I know these people because I spent many years, and I was deeply involved in the global financial crisis. Anyway, I got a response from the office of this to be unnamed central bank governor, which said that he would be very happy to see me later in the summer. To which my reaction was, slight problem of communication.
The pandemic will be over in summer.
To be fair, I think the good news in this is that I think, not to sort of pick an individual, but I think Kristalina Georgieva, as the head of the IMF, I think has really done, I think, terrific work in kind of putting the focus on global health and global health security as central to macroeconomic sustainability and macroeconomic risk management. And I personally believe that I think the challenge here is to demonstrate why global health risks are critical to macroeconomic stability and social sustainability. So, and that's what makes it so important for people who are concerned with macroeconomic sustainability to focus on this agenda. Just as you could make in a way the same argument about climate change. If you don't focus on climate risks it's a slower crisis, but if you don't focus on climate risks, you're going to end up facing macroeconomic and social consequences that are going to be destabilizing. So maybe I can bridge those.
Because, I wanted to start by saying I agree completely with what Peter said, but to give a real concrete example, which is the World Economic Forum in their annual risk report after the Ebola outbreak that occurred listed that as the number one, risk. And by the next year, it wasn't on the top set of lists. And so how we go from this boom and bust to kind of sustained interest in this is going to be critical in terms of thinking about that. And I think that if we don't do that, we're going to have a problem, going forward. It's evolutionarily certain that we will continue to have outbreaks like that. It's interesting. Hopefully it won't be as bad as this is. But, one of the things we've discussed is if you look at this outbreak with cost of $2 to $4 trillion so far, we talk about big costs, but Peter talked about getting diagnostics out, or I'm talking about vaccines out. If you could move up a vaccine by 2 weeks in the current time period, and therefore, reduce the effects on the economy and shuts down and everything else, it not only is not expensive, it completely pays for itself. So, to get that mindset out is going to be important because, as I said, we're going to continue. And the linkage you just made to climate change is really important because it's actually the same problem. If you're sitting in a country, if you're in Sweden and, you handle this perfectly and you have no cases, but the countries around you continue to have spread, you are still at risk. And it's the same thing. If you do perfect climate change, in that country and you are thinking outside, you're at risk. So this is, in a sense, not only a dress rehearsal for other outbreaks, but in a sense, it's a dress rehearsal for the kind of global nature of a problem we have to deal with around climate change and the costs associated with it. Just to answer briefly, you asked for some examples. I give you 2 specific examples. We've been working a lot with the private sector to innovate on delivery systems in Africa. So, for example, in Uganda, how do we do a better job delivering? We've been working with a local affiliate of UPS, FIT, that has been working to work the supply chain to deliver vaccines. They were able very quickly to switch over to doing PPE and changing those mechanisms. And going even a little bit, crazier than that is we've been exploring the use of drones to deliver blood in Rwanda and other health commodities, for example, in Ghana. One of the interesting things is when this happened, all of a sudden you had a delivery mechanism to get supplies without any person being engaged. And those have been used also for these types of technologies. So I think, again, technologies play an important role. The private sector plays an important role. The challenge is making sure the interactions with the public sector is seamless and goes well, because sometimes there's some friction there. Over.
Thank you very much, Seth. So, Amira, you've been listening to these perspectives, and also I want to get a little bit of sense of sort of how you see this agenda with the private sector, and also more broadly this question of how do we come up with integrating these broader risks into the way we think about economics.
Yeah. Allow me first to touch on the issue of the health security, because I had no chance to comment on this. Because us in Africa, we have been challenged all the time that we are a dumping ground for fake, substandard medicines, and the production internally in the continent is limited, and we have problems with the regulations of the policies, the pharmaceutical policies. But also lesson learned in the continent that we are now establishing our own Africa Medicine Agency. We are at the beginning. We have just the heads of state endorsed the treaty for AMA, African Medicine Agency. 16 member states signed, but only 2 ratified. We are now mobilizing our efforts with member states to make them ratify. We need 15 ratifications for this new agency to come into force, because we want this agency to protect Africa, protection, and also we need this agency for the regulation of the policies within the continent and for encouraging more local protection for medicines. Because now people are talking about treatment for COVID-19. I'm sure you know about the different clinical trials happening in Africa, the issue of the organic medicine in Madagascar. So we need also part of our future health security in the continent into filling these gaps we have in this area of treatment and medicine. This is just a comment I wanted to add.
Yes.
What's being said by Peter and Sis. On the issue of the private sector, I can speak from examples. When I came as a commissioner in 2017, and I was reading the reports of the Ebola in the West African countries, one of the things that I really admire and I saw and read in the report, that the private sector of Africa, when the former chair of the commissioner, Madame Zuma, called on them to come and participate, they came, and in a very few days, they gave $50 million to the African Union for the fight of the Ebola. This is an experience that's happened, is documented for the Ebola outbreak in West African countries. Last year in 2019, and Peter Sands was in the meeting, we held a meeting on the 11th of February here in Addis Ababa on the sidelines of our summit, and part of the meeting was directed to be part of the replenishment of the global fund itself. The private sector was engaged, and they came and they participated. And when the outcome of the decisions of the summit, one of the outcomes is a call for action. Also, part of this call for action is for the private sector of Africa to come forward and to have a partnership with the public sector. But this partnership, you said it yourself, it needs incentives. It needs a win-win situation for the private sector and the public sector. So the public sector should know what to give to the private sector, so the private sector can come and to be part even of the development of the local manufacturers of medical products, or to be part of putting money for fighting epidemics, or even building health facilities. So we need this conversation between the public and the private sector to continue and to culminate in having an agreement on what kind of partnership we want to have, whether in Africa or in the rest of the world. Another example I can give you, a current example on this COVID-19 pandemic. One of the meetings of the Bureau of the Assembly, chaired by President of South Africa, he called on the business leaders in Africa to join in the meeting. And they came. The private sector participated in the meeting, and at the end of the meeting, many of them, they put money in the fund. One of the foundations in South Africa, they put $6 million for the fund. Another one put 3 million. Another one put 2 million from the private sector. But not only that, they created a small platform chaired by Strife Masewa. He's the chair of this forum. And they have been tasked on dealing with the issue of the pool procurement of the medical supplies that needed in Africa. And they have already developed their plan. They have already started engaging the manufacturers in China and in other places of the world. And they will be supporting the work of Africa CDC by taking from us the load of buying or purchasing or looking into the quality assurances of the products. This will be done by the private sector. And as I mentioned earlier, that we gave them 3 seats in the board of trustees, and the chair of the board of trustees is the president of the Afro-Exim Bank. So the chair himself is coming from the private sector. So the private sector, for me, from what I see in front of me right now, they are engaged, they are willing to be part of this fight, and also because for them, there is a dimension even for them, because their businesses will be affected by COVID-19. They will be paying also a price if they don't contribute in the fight of COVID-19. They will be also part of the part of the negative impact will be on them. So I think they are willing. They want to be part of this fight. When the president of South Africa called upon them, they came not only from South African region, from north, from east, from central, and from west. We have a diversity of business men and business women. They are now part of our platforms. They are working with us. And for me, the issue of raising and mobilizing resources is not only from the rich and able people. Part of the policy of the fund we established is this fund is for everybody. It's even for low-income people, if for individuals at the grassroots level. Even to give $1 or an equivalent of $0.50 in local currency. So we are trying also to raise the sense of responsibility. It's not only the government and the private sector that we are going to go for this fight and to win it. No, we need everybody in port. And because we need everybody in port, we want them to contribute even with 50 cents to this fund, but they will feel that they did something. And we have different initiatives. Us in the African Union Commission, we are donating 1 day salary from the top officials to the local staff. Everybody is contributing. It's just symbolic, but it will raise the sense of the awareness of the crisis and also the sense of responsibility and the participation in putting solution to this problem of COVID-19.
Now, I think the point that you've just raised, Commissioner, I think about the need to have sense of solidarity is going to be a general point. And really, we're running out of time. And there are many comments that have come online. There are questions about domestic resource mobilization, whether we can use this crisis to reinforce that message, or is it actually going to be harder? But I want to end by asking each of you for sort of a couple of minutes picking up on your very last point and on the comments that Peter and Seth made earlier about this crisis demonstrating the need for a global coordinated response to what is going to be one of several global problems that will come and affect us all, and where, again, the basic point that you can't solve it unless everyone solves it is going to be the key part. So we have to tackle that, and we have to tackle that at a time when multilateralism, globalization are all going through a very difficult patch. And in many countries, there's a sense of actually retreating from globalization and supply chains that are global, and in many dimensions, people want to sort of look after people within their own borders by putting up barriers. And so you have also great power rivalry that is probably more acute than it has been for a long time. And so now in that environment, I want to get your sort of 2-minute take on how optimistic do you feel? How do you feel one can move forward with tackling these global challenges, starting with global health security, in an environment and a climate where many of the attributes of global cooperation are being challenged? And perhaps I'll start with Seth and get your view first on that, then Peter, and then end with Amira on that.
So I have to tell you that normally I get paid to be paranoid, but I'm cautiously optimistic on this one. And the reason I say that is there's no better example than this outbreak of why these are global issues. I mean, here it started, somewhere around Wuhan. We don't know, wet market, not, or whatever. And within a few months, it's in 180 countries. And it doesn't matter whether you're an island state that, theoretically is isolated from the rest, like Australia, or, across the world. That's the way infectious diseases can spread. So at the end, I think it does drive us to remind ourselves that we are a global world and globally interconnected. And I hope that the science will also end up being there. I mean, if you look at what happened with Ebola, there were lots of countries putting vaccines together, but at the end it was a Canadian, vaccine that got transferred to an American biotech to an American multinational is now being made in Germany. That's the way science works. That's the way, manufacturing works. So I know that is only a need-based side, but I think this is the rationale that ultimately will bring us back into a role. Every leader has to worry about their people. I understand that. That's instinct. But if we want good solutions, we have to think about this globally, and we have to share those solutions globally if we want to solve the problem. Over.
Thank you very much. Peter, are you also cautiously optimistic?
Well, I think you have to be, which is not to underestimate the complexities and the tensions and frictions. But as Seth said, the thing that is absolutely clear about this particular problem is that the idea that any one country or community can deal with it on its own and somehow ignore the rest of the world is so totally unsustainable that it forces people to work together. I also think one of the advantages, and there are many challenges to having a world sort of characterized by hyper media and social media 24 hours a day, is that actually it builds empathy. It builds a sense that something that's happening in another part of the world is something you can resonate and empathize and sympathize with, because it looks remarkably like the things that are happening in your own part of the world. And so although there are frictions and tensions at a global politics level, I think there are things that bond us and bind us, and I hope we learn from this, because it isn't, as you say, the only challenge that requires a global response. Climate change is another challenge that requires a global response. There are other disease threats, like antimicrobial resistance, that can only be dealt with on a global way. So I would hope that we see out of this a bit of a revitalization of a sense of global solidarity, because that has sort of diminished or come under pressure in recent years, and we are going to need it. We can only beat COVID-19 through having a powerful sense of global solidarity.
Amira, are you also cautiously optimistic or optimistically cautious?
Before I tell you, Mr. Masoud, I would like to say to my two brothers from Gavi and Global Fund, while there is vaccines trials everywhere in Africa and in the globe, please don't leave Africa out. Keep the seat of Africa for Africa. We don't want to be out of these processes, and we don't want these vaccines to be developed, and then Africa will run to look, where is my share as Africa? So please take my message with you that we want Africa to be part of this, and global action is really required. Global action is really. We are doing what we can do as Africa, but we know, and it's been said by all of you, unless this fight is won everywhere, it will not be won anywhere. Nobody will win this fight alone. So a global action, a coordinated global action is needed. Not only on the health, for the health institutions or between governments on the health. No, economics, social, every sector, we need to coordinate, and we need to come out with a global action to fight this pandemic. In the past, it is Africa suffering from pandemics, but the rest of the world is trying to help Africa. Now every every region is busy with their own problems, because the pandemic now is global. But though it is global, we need support in Africa. We need support from our partners who are in this meeting, and those who are not even in this meeting listening to this conversation. You asked me if I'm optimistic or not. I would like to end up by saying, in every crisis, there is opportunities. We should look for these opportunities. I'm optimistic. I'm a very optimistic person. I think this fight is doable. This fight is doable. And we can win it. Not totally, but we can win it to a large extent. We can reduce morbidity. We can reduce infections. We can reduce even mortalities. But we need to have faith in ourselves. And let me end by saying, in our Creator. Thank you very much.
Thank you very much. Those are very inspiring words. So before we end, Calypso, you've been very listening to all this. Any final 30 seconds before we close out today? If not, I think we're exactly on time, and I want to take this opportunity to thank all of you for participating. I want to thank all the people that joined in and sent your comments and questions along the way. I think you have touched on a lot of issues which will be with us for many, many months to come. And I hope that in a few months' time, we'll be able to get you back together to ask how things are going then, and on our optimism meter, whether you are moved further towards the optimistic or further towards the cautious in 6 months' time. And I'm with you very much, Amira, in your final point that in a way we can win it, but we can only win it if we act together out of necessity as much as out of choice. So with that, thank you all. I want to also thank Calypso, you and Julia, and also Amanda, our colleagues at CGD who have been instrumental in putting this together. Thank you very much.
Thank you very much, Mr. Masood.